Last week, the UK government announced it was setting up an antiviral task force to accelerate research into drugs to help treat COVID at home. The Prime Minister Boris Johnson says he hopes that by autumn there might be a pill that could be sent to people testing positive, which they can take at home to stop the virus from getting worse. British broadcaster and commentator Jonathan Sacerdoti has done some research on this, and he joined me just a short time ago from London.
Well, Boris Johnson gave a press conference a few days ago from Downing Street, the ones that we've all got used to seeing on TV, televised live for us all to watch at home. And he announced what he called an antiviral task force. He said that it was going to be an effort to fast-track the development of antivirals in order to fight coronavirus, because despite the success the country is having with the vaccination program, and it is doing very well with that vaccination program, he said all the scientific opinion pointed towards that not being enough to eliminate COVID-19. And if it's not enough to eliminate COVID-19, that means we've got to find ways to live with it. And of course, those ways to live with it can't just be locking down, pausing life and destroying the economy and people's health in other ways. So what he was talking about was something quite exciting, certainly as a concept, which is that they would put money and research towards antiviral drugs, which he said would eventually, hopefully by autumn even, allow people who tested positive to be sent a pill they could take at home, which would stop the virus developing into something worse, basically stop them getting too ill from it. And even for people who'd come into contact with those who tested positive but hadn't yet tested positive themselves, to also be sent some kind of antiviral drug that they could take at home, and that would perhaps stop them getting COVID at all. So both of these ideas seem perhaps to some who don't know the area a little fanciful, but certainly a very promising way of trying to live in a post-COVID world, or rather a world with COVID still in it.
Because you've been doing some research on potential drug candidates. What have you been finding out?
That's right. Well, the first thing that might be helpful is to draw a small parallel, as I did in a piece I wrote here in the UK, which is to say this is in a way similar to how we treat HIV these days. So whereas in the 80s, the government warned everybody that HIV/AIDS was basically a death sentence, now it's a viral disease that people can live with and die with rather than die from. And that's often been through treatments, including PEP and PrEP. So that's post-exposure prophylaxis and pre-exposure prophylaxis. Just what I described, really, from Boris Johnson's press conference, the idea that you can take a pill that can stop you getting the virus properly, or a pill that can minimize the virus in your body. So the current possibilities, because Boris Johnson didn't mention any specific antiviral drugs except for Remdesivir. That's one we've heard of before.
This is what the US President Donald Trump was taking when he got sick, is that right?
Exactly, that's the one that they talked about a lot in the United States.
And
Remdesivir was an antiviral, or is an antiviral, that was originally intended for use against hepatitis C and was tested against Ebola, but it didn't prove effective for either of those. Now, what it did do, though, is prove that it's a safe drug to be taken generally by humans through those trials. And that means that if it is shown in studies to reduce COVID effects, and it has been shown in some studies to reduce recovery time in hospitalized patients, then that's useful because it can roll it out already knowing it has that safety profile. And some of the other drugs that I've found that are in development at the moment include one from Pfizer, which they're running trials on now. That's got a very uncatchy name of PF07321332.
Okay.
I suspect they may come up with something better if it gets to market.
I imagine.
Yeah, and then we've got some other possibilities as well. There's one called Favipiravir, which has been licensed in Japan since 2014 for the treatment of novel influenza. And in Hungary at the moment, it's quite widely prescribed for outpatient treatment of mild to moderate COVID-19. But there's obviously still some work to do on drugs like that being properly cleared and licensed to be used in the way Boris Johnson described. So if Boris Johnson sounded optimistic, saying that this could be ready by autumn, well, there is some hope because some of these drugs are already in trials. As I said, some have already been used, like Remdesivir, and so we know it could be safe if it's shown to work in the home setting. But certainly he's somebody that's been known to perhaps have an abundance of optimism in his forecasts for COVID, and sometimes he doesn't quite meet up to the goals he sets himself.
What is the current situation when it comes to the drugs that are being used by COVID-19 patients?
Well, the other thing that is quite remarkable in the UK, and Boris Johnson pointed to that as well in the press conference, is the use of corticosteroids in the treatment of COVID patients, and something that was certainly in the case of some really pushed ahead with in the UK. The research was done early on here, and so he said that thanks to that research done in the UK, certain treatments that are now commonplace around the world started here. And certainly the way that we treat COVID-19 in hospitalized patients has improved drastically since the beginning of the pandemic. It's not that long ago, so we can all remember seeing those horrific scenes of people in hospitals around the world dying. Now, that hasn't ended. We can only look to India now and just see how terrible things still can be. And yet, for many in parts of the world like the UK and Australia, it's thankfully not like that, partly because of the numbers and also partly because the treatments are able to help a bit more than they were. But it's still a very, very scary disease because it's unpredictable, and there are people who are still at high risk from dying from it. You know, in the UK, the figures are looking good at the moment, but there are still people getting COVID-19 and there are still people dying from COVID-19. So, 127,428 total deaths from COVID-19 here, 11 daily deaths in the last 24-hour reported period, and the average number of deaths per day last week was 23. Now, that's very low, but that's still people dying from it, still 1,712 new infections in that last 24-hour period. And this is the good moment. They say that we're almost certain to have another peak of infections coming up. So we do have to be very careful still.
Fair enough to say, though, I mean, that there has been a lot of progress with regards to the vaccine rollout there, hasn't there? Particularly when you compare it to the situation we've been seeing in Australia.
Yeah, massive progress here. And again, governments all over the world have done plenty of things wrong, and there's a lot of criticism of them for it. But the UK government, either by good planning or luck, has done well with the vaccines. The UK was, I think, the first country to order a vast amount of the Pfizer vaccine before it was even proven to work, and that's back last summer. And now using the Pfizer vaccine and the AstraZeneca vaccine, which was developed here in the UK, 63.9% of adults have had a first dose. Now here we've also extended the period of time between the two doses required. So instead of 3 weeks, we leave up to 12 weeks gap. It was quite controversial at the beginning, but it seems to be working out because that first dose gives quite a high level of immunity for quite a while, it seems. And that's allowed the government to spread out the vaccines they had so that more people had quite a high degree of coverage, but not the full degree. And now they're doing the second doses as well. So over 12.5 million people have had a second dose. Over 33.5 million people have had a first dose. So these are good numbers, and that's definitely helping Britain to see the light at the end of the tunnel.
It's broadcaster and commentator Jonathan Sacerdoti rejoining me from London.